Welcome, and thank you for joining this webinar focused on integrating caregivers as care team partners, hosted by the National Caregiver Support Collaborative, or NCSC. We're very pleased and appreciative that you all have joined us for this event today. My name is Leah Moran, and I am the content lead for the NCSC's Technical Assistance and Coordinating Center, or TAC. Let's take a look at the topics that will be presented today. So I'll begin by orienting us to some key information to consider throughout the event. And then ACL will provide an overview of the integration of healthcare and social services. Next, we'll hear from a panel who will discuss strategies for integrating caregivers as care team partners. And then finally, we're excited to engage you all in an exercise today to share more strategies and identify some focus areas for integrating caregivers and care teams before we conclude. So we'd like to once again welcome you all and familiarize you with a few Zoom features and information relevant to today's webinar. To submit a comment or question to speakers during the event, please use the chat function at the bottom of your screen. We will respond to as many questions as time allows. And if you do not receive a response during today's event, please know that our team will review all chat submissions after the event, and your comments and ideas will continue to inform future webinars and other technical assistance offerings. This event provides communication access real-time transcription, or CART, and American Sign Language, or ASL, interpretation. To access the CART transcription, click the Show Captions icon in the Meeting Controls toolbar. And we have two alternating ASL interpreters whose video feeds will be spotlighted while they are actively interpreting. In the coming weeks, we will post the slides and recording of today's event on the resources page of the NCSC website. So to start off, let's take a look at what you can expect to learn from this event. At the conclusion of this session, you will be able to understand ways to partner with healthcare providers to address gaps in caregiver support, share and apply caregiver-inclusive tools and strategies in your local healthcare settings, and explore opportunities for technical assistance to better support the needs of aging, kinship, and tribal networks. So now that I've shared our introductory information, we'll transition to our main presentation, and I'm delighted to introduce our first speaker, Christy Kalinsky, the Director of the Office of Network Advancement at the Administration for Community Living, or ACL. Christy, thank you so much for joining us today, and we appreciate you grounding us in how the integration of healthcare and social services has advanced and sharing some examples of how this is happening across the country. So Christy, thanks again, and I'll pass it to you.
Great. Thank you so much, Leah, and good afternoon, everyone. Thank you so much for the opportunity to join you all today. As Leah mentioned, I'm Christy Kalinsky. I direct ACL's Office of Network Advancement, and our portfolio includes strengthening and sustaining partnerships between community-based organizations in the aging and disability networks and the healthcare sector. So I'm going to provide some brief remarks just to set the stage for the expert panelists that are going to follow me. So next slide, please. So I want to start off by highlighting that partnerships between our national network and healthcare organizations have been in process for more than 2 decades now, with support that spanned multiple federal administrations. So this work is not new. It's been in process for many, many years. And our priorities and our efforts today as a federal agency and as a national network are building on various initiatives that have laid the foundation and built on one another over the years. So I'm not going to talk through each of these bullet points on the slide, but I do want to call out a few. So I want to highlight evidence-based programs, including those for family caregivers, which have strong outcomes and are attractive to our healthcare partners. They were really an initial gateway for community-based organization healthcare partnerships, even prior to some more recent emphasis on addressing social needs or upstream drivers of health. I also want to highlight that with the advent of the Affordable Care Act in 2010, so 15 years ago, there were opportunities through value-based payment models, which really emphasized quality and outcomes in healthcare versus quantity of services delivered. And that brought with it an enhanced opportunity for community-based organizations to have a seat at the table. And we saw a shift in our healthcare partners really recognizing the role that non-medical factors like housing, transportation, nutrition, caregiver support play in a person's health status. And then finally, I also want to highlight that within the past 5 years within ACL, we've had a shift in our strategy from working with individual community-based organizations to strengthen their business capacity to effectively partner and contract with healthcare to a more centralized, efficient focus on equipping networks of CBOs. And these networks are led by an entity called a community care hub to really centralize the operational functions and organize a network of CBO delivery partners. And I'll have more on that in just a moment. Next slide, please. So we know that contracting between CBOs and healthcare organizations is happening across the country, and it's growing. A comprehensive survey that's fielded by the Aging and Disability Business Institute at US Aging found that community-based organizations contracting with healthcare has increased from about 38% to nearly 47% in a span of 6 years. So that's a pretty significant increase. This contracting is important to make sure that capacity exists in communities to address unmet needs. I think many of us are aware that Older Americans Act, other grant funding alone just isn't enough to meet the rising demand of older adults and family caregivers, et cetera, across the country. We really need to make sure that we have diverse funding streams to meet the many needs that our network has. Additionally, we're seeing contracting as part of a network of community-based organizations. That's what I referenced earlier with community care hubs increasing. And that's grown from about 20% to 40%. So that's doubled according to that same survey. Next slide. So I mentioned earlier our shift in strategy at a federal level and a growing number of organizations that are contracting through a hub. We certainly have a number of organizations that are partnering with healthcare and have those contracts at an individual CBO level. But like I said in the past slide, we've seen a doubling of those contracts that are led through a community care hub. And the Community Care Hub is a community-focused entity that's really organizing, supporting the network of community-based organizations that are providing services to address social needs. And this is really quite innate to what the Aging and Disability Networks already do. They already have a network of service providers that they're working with within their state, within their region, so it aligns really well. What the hub does is it centralizes those administrative functions and the operational infrastructure that are needed to enable these partnerships. We know that it can take quite a bit of effort, quite a bit of resources to really have that operational infrastructure in place to ensure successful partnerships between our community-based organizations and healthcare organizations. And the hub really centralizes all of that so that each individual community-based organizations doesn't need to have the IT platform. They don't need to have the data security processes in place. They don't need to have the legal review of the contracts. That's all centralized within the hub. So they take care of contracting with the healthcare organizations. They hold the contract. They ensure the payment operations. They manage the referrals. They ensure the fidelity and compliance with the interventions and services that are being delivered. And then, like I said as well, all the technology, the information security, et cetera, is centralized within that hub as well. Next slide, please. So again, credit to the Aging and Disability Business Institute at US Aging for the information I'm going to share on the next few slides. Their RFI provides the most comprehensive picture of CBO healthcare contracting across our network. It's really an invaluable resource, and I reference it all the time in my work. This data is inclusive of all community-based organizations, not just the hubs. So it includes those CBOs that aren't contracting as part of a network, but I think it's still really illustrative. So while specific caregiver support services are included in just under a third of the contracts, as you can see here on this slide, I don't think it's a reach to say that other services like care coordination, home care, nutrition supports, et cetera, are also benefiting family caregivers. Next slide, please. And a quick snapshot of the most common healthcare partners for CBOs that have these contracts. Medicaid is at the top of the list, but there's a lot of different payer types who are at the table. And it's unclear at this time how some of the shifting dynamics in the federal Medicare, Medicaid landscape are going to influence these partnerships. I'm really eager to see when it is fielded, the next iteration of this RFI, because I think it'll be really telling. But as of right now, those Medicaid partnerships are at the top of the list, and as of the last survey, really seeing a pretty significant growth in Medicare Advantage opportunities. Next slide, please. So I also want to quickly highlight the known universe of CBO healthcare contracting across the country. This definitely isn't an exhaustive representation, but I think it's a pretty good representation. And you can see here where there's contracting at the individual CBO level, as well as where there's contracting as part of a hub model. Next slide, please. And finally, I want to conclude by highlighting an example of a CBO healthcare partnership that's focused on family caregivers. I want to credit this information to the Western New York Integrated Care Collaborative. They're a community care hub in Western New York, as their name would indicate. And their healthcare partner is Independent Health. They are a large Medicare Advantage plan in the region. And so with their caregiver support program, referrals are made to the hub from the health plan, from healthcare providers, from caregivers, as well as from their network of CBO delivery partners. The hub verifies the individual's eligibility for the program. They assign the individual to one of their CBO delivery partners, and then that delivery partner conducts an assessment to see if they have any social determinant needs, any social needs. They do a caregiver assessment. They provide monthly person-centered health coaching, as well as a connection to other resources that are needed. And they encourage enrollment in a program called Exhale, which focuses on providing respite support. And this is provided under contract with a Medicare Advantage plan. And finally, the last slide. So just here, quickly highlighting for Western New York Integrated Care Collaborative, the hub example here. The various programs that are comprising their service package, as well as the payer source. And you can see here where caregiver support falls into the mix. But I think, as I said earlier, with respect to the interventions, we can certainly see that, across a number of these programs, there's certainly a role for engaging family caregivers in this work as well. I can see it with the health coaching, with healthy ideas, meal delivery, etc. So wanted to provide that high-level context, a more discrete example of work that's happening within a community in Western New York. And with that, I'm going to turn it back over to Leah.
Thank you so much, Christy, for getting us started by sharing that very comprehensive overview of the important connection and alignment between healthcare and social services. And I want everyone to keep that in mind as we now move into our panel discussion and examine how organizations are facilitating this connection to integrate family caregivers as care team partners. So this topic for our panel aligns with Goal 2 of the National Strategy to Support Family Caregivers, which is to advance partnerships and engagement with family caregivers through efforts such as recognizing them as essential care team partners, including them in care planning, and training professionals on effective ways to work with caregivers. So I am very pleased to introduce our two panelists for today who bring unique perspectives through their work supporting caregivers as well as providers to advance this critical goal. And our first panelist, Jennifer Rabelais, is the co-director of the Center on Aging and Community Living, which sits within the University of New Hampshire. So Jennifer, welcome, and could you start by sharing a bit more background on your role in your organization with everyone?
Absolutely. Thank you, Leah. I'm really pleased to be joining everyone here today. As Leah mentioned, I co-direct the Center on Aging and Community Living at the University of New Hampshire. And so our center has a variety of projects and programs, with caregiving being one of our primary focal areas. We partner with our state unit on aging across many projects and initiatives. And in addition, we support a statewide coalition focused on the health well-being of older adults in our state in New Hampshire called the New Hampshire Alliance for Healthy Aging. And so the New Hampshire Alliance for Healthy Aging engages over 600 individuals representing approximately 380 organizations and or groups across our state. And so for a small state, that's quite a large critical mass of our aging network. Thank you again for allowing me to join you today.
Terrific. Thank you so much for that additional background, Jennifer. And our second panelist today is Dr. Anna Chodos with the University of California, San Francisco, or UCSF. Anna is a geriatrician and the director of Caregivers as Partners in Care Teams, which is one of the National Caregiver Support Collaborative's 6 grant projects focused on advancing the national strategy to support family caregivers. So welcome, Anna, and I will turn it over to you to share some more background on your project.
Absolutely. I hope you can hear me. And oh, great. Wonderful. So this starts to summarize our program. And yes, we are one of the grantees trying to realize this idea of incorporating caregivers as truly partners in healthcare for, people living with disabilities or, anybody really that, as we know, caregivers is a very diverse term. But we do focus on people caregiving for people, adults with disabilities, adults with dementia, and even the caregivers that might be called like kin or grandfamily caregivers. But the motivating idea here is we're a little bit, if we think of this bridge between healthcare and AAAs and community-based organizations serving caregivers, we're really in the middle of that bridge, but we are on our way to healthcare. So we're bringing the message to healthcare. We're trying to get healthcare to gain the skills to understand the resources that they have at hand to do this work of incorporating caregivers. And as a healthcare provider myself, and as someone who spends most of my time there, and that's why I'm really interacting with caregivers, it's bringing that context and that understanding of the healthcare environment and what's really going on there and what's really feasible, bringing that knowledge to a way to connect with AAAs and CBOs and get healthcare providers to understand what that connection looks like. However, we really do have to do some basic skill building. So the Caregivers as Partners in Care Teams program teaches core, and we call this foundational skills in this work. So when you are working with someone who has a caregiver, the first step that we teach is that people need to be able to identify the caregiving team. Is there one caregiver? Is there more than one caregiver? What does that really look like on the ground? So not just, not just sort of a formal, is there a healthcare proxy, which of course we also advocate to ask for, but really, and we even say things like, it's okay to be nosy. And that's one of the goals here is to really understand the day-to-day life of the person who has some care needs, and then what the caregiver is responsible for and doing. And of course, using sort of an open inquiry method so that we capture that information when people may not actually be identifying as caregivers. So if you were to just open the conversation with, are you a caregiver? They may not answer that in the affirmative because they haven't really identified with that role yet. But when we ask about the task, that's when we can really start to identify the caregiving team. The second piece that we teach in the foundational skills to the healthcare teams is how to then engage caregivers. So what is their role? Again, you get that from the identifying piece and that step in the process, but how do they feel? This is the part of understanding how they feel in terms of their preparation for that role. The second part of engaging, though, is, of course, around the emotional well-being piece of caregiving. So acknowledging that that's part of the work and having validated, structured tools, of which there are many, to identify if there's issues around emotional strain on top of the just actual practical skills and strain or lack of preparation around the practical aspects of caregiving. And finally, support. And this is where, again, if you imagine the metaphor of the bridge, this is where now we're getting the healthcare team to see that they need to cross the bridge and they need to connect with the CBOs and AAAs that do the absolute, much better work than we can do in healthcare, but do the on-the-ground work in the community work supporting caregivers, be it with actual services, be it with education and training for the caregiving role themselves. So those are kind of the three pieces we teach. And it's sort of in that order. Of course, it may in real life be happening in some sort of parallel mix of all these things happening at once and happening over time as someone who needs care or is getting some care, as their situation and caregiving situation changes. I should say, just to zoom out a little bit, CAPCT is free, so all of our training is free. It's national, so we don't have a local focus. We are based in California because that's where we work and where many of our partners are that are helping us to develop all this training, particularly UC Irvine, in addition to our UCSF partners, and UC College of the Law, as well as really substantial partnerships with an Alzheimer's and dementia-focused training program that we have at UCSF called the Global Brain Health Institute, and the Archstone Foundation, which is a philanthropic organization really focused on community resource building for caregivers. That was really excited about this work that we get to do with the NSCS. And then just want to say that we really emphasize throughout how important engaging, incorporating, partnering with caregivers in care is to the patient. Of course, this is our client, the care recipient's journey, both in terms of it improves their health, it improves their outcomes, and it, of course, improves the caregiver's health, well-being, and outcomes as well. I believe we have one more slide just to say a little bit more. So really want to, at the end of the webinar, you'll definitely get our website, carepartners.ucsf.edu, but that's, of course, sort of on top of the microsite for the NSCS. You will find all of our resources there. So we have the foundational skills, which I essentially just presented to you, but of course we go into deeper information, case studies. We have videos to demonstrate these skills. For each of those three pillars, identify, engage, support, we have short 15-minute deeper dive webinars. All of these things come with continuing education credits as well, because we know that's important for the precious time that healthcare teams have and ongoing learner needs, and we all have to manage and take note of these credits. We actually just released our grand family and kin caregiver module as well, so that is now available. That's very recent. And we are in developing and in progress modules that really focus on how this works in an inpatient or hospital setting where the healthcare team might look a little different, the time, the resources, the acuity may look a little different. And then also we have a module coming up on how this looks in a nursing home setting where, again, transitions, the person's situation, their caregiving needs may be escalating, just, many different considerations. So we really wanted to not only take into account the different types of caregivers, what their needs might be, and therefore what the supports they need in the community might look like and how those might be different, but also these different types of healthcare settings, because if we're talking to the healthcare team, and would love to get the audience's thoughts on this, we're targeting a little differently. People think a little differently. And if I didn't sort of make it explicit already, the foundational skills course is a little more situated in an outpatient setting, like a regular primary care clinic. Also, just want to say we've created some additional resources. So I know later on we're going to be talking about how to really make this work, how to reach healthcare. And so we have some tools that we've created to sort of support healthcare teams in doing this work of identifying, engaging, and supporting caregivers. But we also have really practical things like, how do you bill for this? So how do you make this a sustainable practice for the time that you need to spend? And we continue to add website and resource guides. And of course, this is all accessible or, summarized as well on the microsite that I know is going to be available to you. So really want to emphasize that as well. I'm going to, I see there's some comments in the chat, and I will do my best to respond to those. And I would also like to pass it now on to Jennifer.
Thanks so much, Anna. That's some really helpful background as we move into our panel discussion. And Jennifer, thanks for sharing your background as well. So I now have a few questions for the both of you to learn more about your initiatives related to this topic. So our first question is, what strategies have you found most effective in promoting integration of family caregivers into care teams? And how have these strategies improved outcomes for caregivers based on what you've observed? So Jennifer, I'll start with you first. What strategies have you found most effective?
Yeah, thank you, Leah. I think I just want to go back to something that Anna said, which is often the integration of family caregivers into healthcare teams starts with that formal identification by the healthcare team. And so that process, though, can be influenced by the ability and willingness of caregivers to self-identify as caregivers. So one of the primary strategies that I'm going to talk about is around caregiver self-identification. We know that if caregivers are not identifying as such, they're often less likely to reach out for supports for themselves as well as for those that they care for. So the statewide coalition that I mentioned earlier, the New Hampshire Alliance for Healthy Aging, includes supporting family caregivers as one of its primary priorities, and lifts up several statewide strategies to support caregivers within New Hampshire. One of the strategies of this group is a caregiver self-identification initiative. And through this initiative, materials were developed that do, and Anna referenced this as well, so I'm happy to see the interconnectivity in the dialogue around your work as well, Anna. So the self-identification materials were designed to connect the tasks of caregiving with the role of caregiving, really out of recognition that we know that caregivers often don't self-identify until later in the process, and so they're not reaching out for resources until much later in the caregiving process. And as Anna said, we found often if you ask somebody if they're a caregiver, the answer will be no. But if you ask that same individual if they're performing specific tasks related to caregiving, if they're shopping or helping pay someone bills, or even providing personal care, we often find that same person who says they're not a caregiver says, yes, I do these tasks. So there's a definite disconnect between tasks related to caregiving and identifying with the role of caregiving. And I think that's for a variety of different reasons. So we have chosen to create materials that really elevate the tasks of caregiving and make that connection with the role of caregiving. And we've branded them underneath the heading, Do You Care? And so really lay out, here are some of the tasks. Did you know you might be a caregiver? And then as part of the materials, we include the statewide Aging and Disability Resource Center phone number as a connection, as that first step to reach out for resources. So under this initiative, as I said, the materials have been developed. We've been sharing them within the aging network in our state to senior centers, libraries, community centers. But more recently, our focus has shifted to sharing these materials with medical providers. And this really happened through a partnership with the Medical Society in our state, who took a great interest in what we were doing and have helped share our materials through their listservs and in their newsletters. And so out of what started as an initiative that was really focused on lifting up caregivers, helping caregivers identify and pointing them towards the statewide Aging and Disability Resource Center, to really become a springboard for deeper conversations in our state with medical entities, medical providers, again, with that assistance of our medical society, to begin to talk about the important role that caregivers play, how medical providers can assist caregivers in self-identifying, and that's when we're able to share some of these materials that can be placed in medical offices and can be a springboard for conversations between medical providers and potential caregivers that come in through their door. So the work of the initiative continues to evolve and expand, but we are currently really focusing on this outreach and partnership with medical providers at this time. Again, with using the materials as a tool for fostering recognition of caregivers, the role that caregivers play, but also lifting up our aging and disability resource centers within the medical provider network as a really important resource that medical providers can lean into. And I'll stop there.
Fantastic. Well, certainly a lot of really great initiatives that you all have in New Hampshire. So thanks so much for sharing those with us, Jennifer. And just a note, I see some folks are really interested in what you shared in the chat. And we have some time at the end of the panel to pick a few of those chat questions for you all to respond to as well. So we'll keep tracking those. And in the meantime, Anna, if you could share some of the strategies that you found to be most effective as well.
Yeah, I guess what I would add when I'm sort of coming from the lens of defining a care team as a healthcare team and sort of this one, not the only, but certainly one critical entry point into really engaging that caregiver and supporting them. I think some of the strategies that have been effective are, being really concrete and giving clear evaluation tools, and by tools I mean maybe like a structured survey, like a lot of us know like some of the caregiver strain surveys, but also just creating tools. We're so bound, to be honest, by electronic health records right now, so having just concrete tools in the electronic health record and clear structure within it to document and integrate care providers in that way, and caregivers, because it's kind of like if it's not there, it makes it a outside of the norm process, or sort of an idiosyncratic process for each social worker or each nurse or each healthcare provider, and then it's not routine and it's not just part of what we do. I would say right now in healthcare that is still in progress in a lot of places, like where we all because for some places it's just where the emergency contact is, or it's just somewhere in a note or something like that. But what we're trying to do is really help places put structured assessments and documentation routines for addressing caregivers. That doesn't really address like what we're talking about in terms of the skills and competency in working with family caregivers effectively. That's more just like the absolute foundation of being able to work with caregivers. But I will say some of this is changing. So some of you may be in areas where they have something called a GUIDE program. This is a CMMI innovation program for people living with dementia and who have Medicare. And they are requiring that caregivers be identified, their names be documented in the care recipient's record, and that they have an assessment for, through the Zaret burden scale. And so these are really important changes that I think will have a ripple effect. And some of that I think is leading to truly meaningful integration or better care. And then the other thing is really thinking about all the tools, like every step of a healthcare encounter or hospitalization, and how we're weaving in and supporting caregivers throughout, and making sure that we're giving sort of a comprehensive effort to find opportunities. So another example is like the summaries that most people get after a visit. Often, is there a way to incorporate the caregiver into that before it's sort of finalized and distributed? Unfortunately, it's often a checkbox for a lot of visits that you have to give people a discharge summary, or you have to give people an after visit summary at a clinic visit. But using that as an opportunity to engage the caregiver, like what helps you as a caregiver to be in this summary, not just the care recipient, like the patient. Can I give you an extra copy? Are there other ways that we can support you being informed and having a conversation with us as the healthcare team about this plan? So like using these tools that are there to expand them a little bit and make them more inclusive of the caregivers. And really the biggest thing is there's great evidence that when we engage caregivers in a meaningful way, again, not just what's their name and are they a caregiver, but what are their needs as well, and can we connect them to resources? Definitely those sorts of interventions do show better outcomes for caregivers in terms of perceived strain, perceived quality of life, and practical, meaningful support in the community.
Absolutely. All really great strategies as well to engage the caregivers. So thanks for sharing those in addition. And we can take a look at our next question now, which is, how has your organization supported teams in building the skills and knowledge needed to include family caregivers in care planning and delivery processes? So Anna, we heard a little bit about this already from you when you described CAPCT, but I'll start with you since your work offers a lot of support on the provider side. So what would you say in terms of how your organization has supported these teams?
Yeah, so I think one, and if you are in a position in your organization to be that liaison to healthcare, I think one thing that we've done that has been useful to supporting teams is just finding opportunities for information sharing and education that exist and just being super duper flexible and folding into that. So if you work somewhere where that particular healthcare center has trainees, they always need education. They love hearing about these things. That's a great group to capture. The other is just regular staff meetings. And believe me, I just want to also acknowledge, like, if you are not from within the system or you're not a clinical person, it can be very hard to get traction. But there's always people who are not going to want to talk to us or not going to want to move forward in this way. But it's really about finding those people who do and, continuing to look for those partners, those champions. So that's what we've basically done, is really focused on champions, focused on people who, help organize continuing education and information sharing sessions. So how do I make referrals to this group in this way? This is the updated information. The other things, again, I think structural changes are they're also a focus because, it really reinforces the skills and knowledge that we're training on. So working on so some health systems now are doing referrals through their electronic health record to community organizations and sort of keeping it within that flow instead of doing separate faxes or separate papers or having a separate process, because that always kind of breaks down the efficiency and the consistency of those services being used. So working on finding champions within healthcare that want to work with you on creating those links. So like we had an organization not that long ago that was willing to, they helped me get the information I needed to connect our EHR to their organization so we can start having that communication more streamlined. Again, the other thing too is helping build tools within the system that people are using to quickly get the information. So for us, it's about building like standard templates that doctors and nurses and social workers can find that bring up the information. Like if this caregiver really needs respite, here's like a couple lines about that and information that you can put into the visit summary and also informs the clinical team about how to make that referral. So basically we've tried to support structural changes and make use of any opportunity we can to get people education and information. And again, whenever you can, use little incentives like continuing education credits, or, we'll bring some snacks to the staff meeting or something like that. Like it's really simple stuff, but it does help get a little more traction sometimes. And I do want to say, somebody just mentioned in the chat, and there's just so many great comments. I wish I could get to them all, but how do we support doing this kind of work when sometimes health systems are reluctant because of privacy concerns to start over incorporating caregiver information into the chart or sharing information with caregivers? And I would say there you do need again, usually somebody internal or a clinical champion who's willing to learn about where the boundaries are for that organization. And some providers will never, or healthcare folks will never they learned it once that you're not allowed to talk to somebody unless you have a signed form or something like that. And they never revise their understanding or update their information. But often a clinic or a hospital will have a policy that actually is more inclusive or can be sort of revisited and re-emphasized. So kind of just reviewing that and reassuring people that they're not acting outside of policy. And again, this comes up all the time in the dementia work that I do. It's just completely standard of care and completely appropriate to involve caregivers. It makes zero sense whatsoever not to involve caregivers intensively in the care of that person, and to document that in the chart and to give them a phone call when you need to. So it has to be policy has to be rational. And when I need to reassure colleagues, I do. But it's a great question. And Guide, I'll say this again, Guide, we went through this because Guide wants you to record caregiver information, again, name, birthday, Medicare, enrollment information for that care, for the not that person, but for the patient. So you're recording that information in their chart. And we had to go through a privacy review and made sure we did that in a way that was appropriate, but it was deemed appropriate, as long as it fell within certain parameters. So it's all of this not only makes sense, it's doable, but we do have to be thoughtful and obviously it's coming from a good place, right? People want to protect privacy, but we have to also point out how absurd things are when we can't involve caregivers. So I just wanted to thank that person for that question.
Thanks so much, Anna. And you all certainly have a lot of different ways that you're working to help those care teams out, to really draw in the caregivers. So appreciate all of that information. And Jennifer, I know that your work is focused more on supporting the caregivers in their integration into the care team. But just before we move to our next question, wanted to see if there was anything else that you wanted to add in response to this one.
Thank you. I would just add briefly in supporting caregivers, but also in supporting community-based organizations across our state. So I think when I think of community-based organizations as being champions and supports for caregivers to be a part of a healthcare team, I really think about the importance of and really lifting up the person-centered training for organizations in our state, the importance of caregiver assessments and using those assessments as a tool, and really strategies to empower caregivers and educating caregivers. There's wonderful programs that are disease specific that educate caregivers that can build their confidence in being an active member in as part of that healthcare team.
Fantastic. Even more great resources that you all are sharing. So we can now move to our third question, which is, how do you measure the success of integrating family caregivers into care teams? And what are some indicators of success that you've identified? So Anna, how is the UCSF team measuring success here?
Yes, thank you. I'm going to, again, speak somewhat generally because our program is really powered, not empowered, but powered literally with resources to be able to really just measure our level of reach in terms of training and, if people feel like they're learning from our materials and things like that. But I think if we think more broadly and what the evidence shows around what does success for integrating family caregivers into care teams look like, the real indicators around that are caregivers reporting feeling included and caregivers showing, again, typically with these structured instruments that we look at over time, like the Zarit scale or ZARIT or something like that, or other quality of life scales. Just looking at, how those improve, which is sort of the goal. The other piece, of course, is does the person who's on the receiving end of care, have fewer hospitalizations, have more goal concordant care, so they're able to get what they want. And again, the chat is just full of really, really thoughtful questions. And somebody pointed out that they hear so much from caregivers how unengaged they feel during visits and how their concerns and needs aren't addressed. So it really honestly could be something as basic as we're doing a really focused caregiver assessment. We're tracking, out of people who have been identified to have a caregiver, we're surveying their caregivers and just asking them once a year, in the last year, how appropriately involved and like directly spoken to do they feel like they've been. And it's really kind of as simple as that. And I think the research on the other, behind all this has shown that when we're doing that kind of thing, people's healthcare and quality of life is better. I also saw a really, really thoughtful question about what do we do when like the caregiver's needs and the person's needs are really not matched. Okay, so for example, we see all the time people who the care recipient is just has so many needs and they don't have that bench of support. They don't really truly have a team. They may have one or two family members or friends who are part of the caregiving team. And that's just not enough as their needs escalate. And then of course we're hearing from the person, I still want to stay in my home. I want the current situation. I don't want anything to change. When we're seeing from the outside and we're hearing from the caregivers, like, I can't continue on like this. I can't keep going. And these can be really tough situations because we have to live in reality. If this is not going to work out and that caregiver is going to walk out the door at some point out of sheer exhaustion and self-preservation, then that's a reality that needs to be considered. So I think at the end of the day, we are never in a position where we can just support somebody to some sort of endless degree because that is their preference, which is pretty normal to have that preference, I have to say. I wish it were so that, of course, that we could support everybody. There's nothing for almost everyone, there's nothing necessary about a supported living situation or a long-term care nursing home situation if we could provide that all in a home, which almost always you can, except for like ventilator exceptions or something like that. But the reality is we have to like carefully weigh that and all along the more we can support a caregiver throughout, the more reserve and resilience they're going to have throughout. So this is why I guess another thing to emphasize, an indicator of success would be how early are we doing this? Like how early in the caregiving journey are we identifying people, connecting them to resources? Because often we're only figuring this out in these times of crisis or utter and total exhaustion, and when we're bringing in emergency respite and all those things. And that's really clearly not the ideal way to do it. So I would say hopefully in the future, another indicator we can put on the table is how early and for how long did that caregiver feel supported, not just do they feel supported now or do they feel more supported than last year? Okay, I'll stop talking and see if Jennifer has anything to add there too.
Yeah, those are really great measures. And it's wonderful that you're also kind of seeing those firsthand stories as well, in addition to the more quantitative metrics about the reach of your training. So Jennifer, anything else that you would add about ways you've measured or observed how your work is allowing those caregivers to integrate more into the teams?
Yeah, like Anna, I think I would answer this more from a high level global response, and it really makes me think of care transition work that's happening or has happened here in New Hampshire. So New Hampshire piloted in 3 counties a care transition model, and through these pilots there was a formal partnership between the Aging and Disability Resource Centers and hospitals that was developed so that there was a direct relationship between discharge planners and Aging and Disability Resource Center staff. And so the Aging and Disability Resource Center staff person provided specialized care to help transition individuals as they were being discharged. And that support really emphasized person-centered planning, inclusion of caregivers in that planning process, a connection to community resources, and support during that initial period. So visits sometimes while they were still in the hospital or immediately immediately after they were discharged to really provide that deeper level of case management and support. And so partly why that raised up for me, while that's not focused directly on, it's a way to integrate caregivers into a healthcare team, particularly upon discharge. But I think about the measures of success that were used for that care transition program. So some of the measures were reduced patient readmissions, improved patient satisfaction, reduced caregiver stress. So I think all of these really point to measures that would be valuable measures and would stand true. I think the literature tells us that these are also that could potentially be benefits for integrating caregivers into a healthcare team. So if we look at that, really look at, how is that caregiver, how are they doing? What is their satisfaction, the caregiver burden levels? I think that is one approach to measuring success.
Yeah, that sounds like a great approach and certainly really person-centered, which is what we're looking for. So that's terrific. All right, we have one more question for you both. So our final question here is, what are your recommendations for actions that aging, kinship, and tribal network organizations could take to collaborate with healthcare providers or to enhance caregiver support and integration? So Jennifer, I'll open it up to you first.
Thank you. And this is a lot of what we do, actually. So I love this question. So my overarching recommendation would be that organizations outreach to their local healthcare providers. Make sure they're familiar with your organizations and your resources. Build those relationships, because as you build those relationships, that's where the opportunities come to develop and identify shared goals, and goals that are important to both patients and caregivers. I think that organizations could consider developing formal relationships with healthcare entities, kind of like I described in that care transition pilot. I know that capacity can often be an issue, both for nonprofit and community-based organizations, but for healthcare entities alike. So out of building these relationships, it could be very valuable to identify shared resources and how both sides can support each other. I also believe, and this is something that I'm very interested. I really believe that it's important for organizations to understand how the CARE Act is being implemented in their state. And so the CARE Act, for those that don't know, is the legislation which is enacted in almost every state. I think it's 43 states. And it stands for Caregiver, Advise, Record, and Enable. And what it is it's the legislation that requires hospitals to identify a caregiver, to inform family caregivers of discharge, as well as provide training to family caregivers related to tasks they might have to perform when their loved one is discharged. And so where the opportunities are here that we're finding in our state, it's not really clear how legislation is passed, but it's not really clear how this is being implemented across our state and what this looks like. So as we're building these relationships with hospitals, it's an opportunity to understand that process, to understand the resources that are being shared. Are there additional resources that we could share and offer up? Or are there ways that community-based organizations can support that discharge process? Similarly, what we're seeing for conversations with hospitals when, as part of this building relationships that we're doing through the self-identification initiative, is really sitting down to understand each area hospital's community health assessment, what it looks like, what are the results, are caregivers centered in that, and how can community-based organizations partner with healthcare entities and hospitals to meet the gaps that are showing up in these community health assessments. And I'll turn it over to Anna with that.
Thank you. I know we're like very close to time, and I'm just in general, again, just want to say really grateful for having this conversation and this discussion, because I think we've gotten through a lot of great stuff. And the only thing I can really add is, and I think you mostly said this, Jennifer, and just to put a finer point on it, if you're talking to, it's like, what problem are you solving for them? Most healthcare providers, healthcare teams, like, don't have a lot of bandwidth to do meaningful caregiver support and connection. And so, the simpler and in some ways, like, more helpful, we can be. So, okay, when you have a caregiver who seems burned out, just have them call this number. Like, we want you to really know this number, popularize this number, make sure all your social workers have it. This is the information you give to caregivers. And some of that may be you looking for a contract, but it may also just be, this is your mission and you're trying to help. There's somebody asked, like, what do we find most helpful about giving to caregivers? This is the whole issue of, like, identifying and engaging them, is like, you need to know some of what they probably need to support. So in general, I don't have one catch-all resource, although in California we have caregiver resource centers across the state. We do have one that's fairly convenient and local. So sometimes that will be my catch-all resource, but I try actually to give fewer resources but higher impact for that person. If it's really a legal situation or they really need respite, like they're really, really burned out, or these sorts of things, like just trying to, or a dementia-specific organization. And I try to train our healthcare teams is, like, know a handful of resources in all these key areas so that you can tailor a little bit. And so we do not have one mega handout. That really is our AAA. Basically, it's like I would send them there to get assessed and connected. But I do try to have, like, in my pocket, like, something for people with dementia, something for certain cultural or linguistic specific communities, that sort of thing. So just want to put that out there.
Thank you so much to you both. Those are some really thoughtful recommendations. And I think we can just take the next couple minutes here for one question I see in the chat, because you all shared just a wealth of information there. So one that I'll pick out here to see if you all have thoughts is, can you speak to strategies for Aging Network to support caregivers in navigating situations in which their preferences may be at odds with those of the patient or other structures within the healthcare enterprise, such as insurance restrictions? So do either of you have thoughts on that one?
Which one is this? The one?
I know, it's hard to track because there's so many great pieces of input in the chat. I'll read it once more here. So can you speak to strategies for Aging Network to support caregivers in navigating situations in which their preferences may be at odds with those of the patient or other structures within the healthcare enterprise?
Yeah, and I was trying to answer this a tiny bit. I guess what I would say is it is okay to acknowledge that the caregiver has very valid concerns. And, like, we really talk about starting to think about this in a dyadic, or like the caregiver and the care recipient kind of relationship, because that's real. You can't pretend that the care recipient's needs are the only ones that matter, right? That is kind of the whole point of integrating the caregivers. So trying to acknowledge that and determine what, if anything, we can do. And again, trying to prevent a crisis like that to begin with, where the person just feels like they have no options, like their caregiving role is impossible. There was something alluded to also in Ohio about how they're talking about, like, the natural scenario of a caregiving social network, and just using all of that up before you use, Medicaid funded benefits. And that's obviously also kind of nuts, because what you're trying to do is prolong and facilitate and make that caregiving relationship resilient. So I would, to whatever degree we can decide what is an appropriate natural amount of support in that particular scenario, and then support accordingly. Trying to be flexible in that way if the law or the Medicaid policy allows it, because we can't burn out people and then hope that like we can arrange something that's going to work for the person. Like that's nobody typically even really wants that. And that's really breaking down the family structure or the natural social network structure in a way that isn't healthy. So I try to take this early, try to get resources early, use respite as much as possible early, even if it doesn't feel emergent. Like people still need a break. It's okay to take a vacation, and just sort of make this a constant stream of more routine and thoughtful support throughout.
Excellent. Thank you, Anna. And I know we're just about out of time here, but Jennifer, just really quickly wanted to see, is there anything else you wanted to add in response to that question?
No, I think in recognition of time, I think Anna had some great suggestions.
Excellent. Thank you. And so I know there are so many questions and great comments in the chat here that we unfortunately won't have time to get to, but I do want to walk us through some closing and next steps here and describe some other opportunities that you all can get in touch with us if you have outstanding questions or other ideas. So if you're interested in learning more about this topic, we encourage you to explore the resource guides, trainings, and reports that we have on the slide here for you, and we're also going to enter them in the chat, so you can just copy and paste those out for your future reference if you'd like. And then finally, to close us out, I'd like to once again thank our speakers for sharing your insights and perspectives with us today. And the materials for this event will be shared on the NCSC website in the coming weeks, so please visit our website to stay up to date on forthcoming resources as well. And for any technical assistance requests or questions, you can please email us at caregivercollaborative@acl.hhs.gov. And then lastly, we encourage you all to fill out the survey that will pop up as you close out of the Zoom meeting. So we would love to hear from you about your experience attending today's webinar and what topics you might be interested in learning about in the future. And once again, we're capturing everything that you all have submitted through the chat as well. So thank you again for joining us for this webinar, and we really appreciate your time and participation today, and we hope you'll join us for other upcoming NCSC events. Thank you so much.